This is the Her Earth Medicine podcast, based around traditional Eastern medicine and naturopathic insight to support wellness and longevity. My name is Sandy Ross, and I am a naturopath and practitioner of traditional Chinese medicine. Thank you for tuning in, and I hope you enjoy this episode. Today on the podcast, I am chatting with naturopath and nutritionist of over 20 years, Ross Walter. Ross specialises in the area of pathology, so I've brought him on to debunk a few theories around what we should be looking at either as naturopaths or as patients around our blood test results. I hope you enjoy this episode. Welcome to the Her Earth Medicine podcast, Ross Walter.
Good morning. How are you, Sandy?
I'm great, thank you. Thanks for joining us, Ross. I'm very excited to chat naturopathic interpretations of pathology with you.
Excellent. Thank you for asking me. Pleasure to be here.
So before we dive into chatting about the naturopathic interpretations for pathology, do you want to tell us a little bit about your background and how you sort of went down the avenue of reading pathologies and sort of having your own tweak on things as a naturopath and nutritionist?
Sure. So I am a clinical nutritionist, naturopath, and herbalist as well. I'm based in Brisbane, but I work online, so I'm accessible anywhere. I have been practicing for quite a number of years, and I specialise in chronic and complex cases. So people do come to me and started coming to me with a lot of their pathology, and understood that we don't typically get taught a lot about how to interpret pathology properly in our college or uni. So I'm a bit of a nerd. I like the technology. I like the detail that the pathology can actually give, and finding out what's actually going on in someone's body rather than just going on the signs and symptoms, which are really important, of course, in the diagnosis. But I really want to get to see what the body's doing on more metabolic level. And so I've always been interested in pathology and pathology results, and it just it's just been an ongoing learning for me ever since I was even actually still studying. I came across some webinars and some online courses for pathology interpretation run by some US and Canadian trained naturopathic doctors. And so I actually signed up to do some pathology courses while I was actually still studying. So it's been an interest for a long time. So I've just learnt more over time from that as well. And working with some other experts in their field on this as well, and it's just been sticking in my brain for a long period of time, and people come to me, new clients come to me with their pathology results, and particularly sort of giving up on the medical system to a degree, because their doctors will just say that all their results are all fine, or there's nothing wrong. But they know, the patient knows that something is wrong. I mean, they wouldn't go and see their doctor otherwise. So they perhaps look at seeking out a second opinion. And I think that's a benefit that we as natural therapists actually have, is that people are coming to us for that second opinion or third opinion or 20th opinion, perhaps, that are looking at it from a different point of view, looking from a non-medical or more of a holistic or natural point of view when they realise the medical system isn't working. So I've just built up my my knowledge or my information on interpreting pathology over time, and I do, as you say, I've got a very different tweak to it. I'm more interpreting the pathology results, looking at what we know are the optimal ranges for the pathology. So not using the reference range, which is a bit of a long story, but basically the reference range is just a statistical average of people that have had tested at laboratory. So you can get your same blood sample taken from a lab and split up into 2 different files, sent off to 2 different labs, and hopefully they'll come back with the same result. But even then, that's not guaranteed because they use different equipment. But they'll guarantee that the reference range that you get on the results will be different because the labs use and have a different statistical range. So that's a problem. It's the statistical range. And when you sort of think about it, and actually I explain it to my clients this, or I ask them this question: do healthy people get blood tests? And then they think about it for a few seconds and they go, well, actually, no, they don't. Healthy people don't go and see doctors. Healthy people don't get blood tests. So why on earth is a doctor using that statistical range, being the reference range of, let's say, 95% of unhealthy people? Why are they using that to compare your result and to try and get an analysis of whether you're healthy or not, or whether your organs are functioning or not, or whatever's going on? It's a stupid, ridiculous idea. And that's why so many people, if not all, patients who see doctors come away sort of somewhat disillusioned that the doctor can't find anything, or suggest, well, it's all in your head, because they're not actually interpreting the results properly. And so it's a combination of all of these things has sort of led me to continue learning more about pathology, how to interpret it, put on it in a very different way. So using the optimal ranges for sure. But I know that let's, for example, take the red blood cell count, or the red blood cells in general. I know what nutrients, as a nutritionist, what nutrients we need to make those, what organs and tissues are needed to in the development of those red blood cells. What can actually happen when we're deficient in some nutrients? How's that actually going to affect the red blood cells? Are they going to be larger or smaller than the normal, or more or less optimal? And so, put it together in a very different way. So I'm actually interpreting the results using the optimal ranges, but looking at different tests or the test results, and looking at the nutritional deficiencies, or perhaps excesses in some people. What are those deficiencies actually causing in those abnormal results? So the interpretations I'm giving to clients is that you're actually deficient in these several nutrients, for example, and I explain why, and link it back to the symptoms that those deficiencies can cause, and that would make complete sense to every client that, well, if they're deficient in B12 and folate and iron, for example, of course their red blood cell quality and even their red blood cell count is going to be suboptimal, and that's going to lead to poor energy, fatigue, even headaches, migraines, muscle aches and pains, and many other symptoms that they may be experiencing. And then they go, oh, actually, yeah, that makes sense. I'm getting those other symptoms as well, which I may not have thought about at that time. And so they can see then certainly comparing the interpretation of the doctor, which is basically everything's fine, everything's normal, with me saying, you've actually got these deficiencies, it's affecting you in this way, you're having these symptoms, and they go, oh yeah, that makes sense. And you get a huge amount of, well, I think so, a huge amount of credibility with the patients, that you can actually see what's been going on with them when they're often their doctors haven't been able to. It's it's an amazing skill, I think, that we all should have as natural therapists, to be able to understand that, because unfortunately, just due to the doctor's training and their understanding, or lack of, with regard to pathology, that people are not getting perhaps the treatment that they really need. And we can do that. We can fill that hole for them and actually give them some help and some treatment and make them feel better and turn their conditions around.
It's certainly an area to invest some time in upskilling, because everyone knows, in the general public, when they want to have a checkup, they go to the doctor and they'll get some bloods done. They might get their blood pressure and whatnot, but it's just something that everyone does. And everyone goes and checks their bloods. Well, most people do anyway. And, most naturopaths are now really kind of on the bandwagon of functional medicine, which is great, myself included, and you get a lot of information, but it does come at a cost, and not everyone can get that. So it's certainly important to be able to, start with the baseline of pathology interpretations. Can I ask maybe a little bit about some of the issues that you find with interpreting pathology results?
Obviously, the key one is, doctors just don't often find any issues in the results when they're using the reference range until directly the patient result has actually gone way above or way below the reference range, and even then sometimes I've seen them completely ignore absolutely obvious things, whether it's the very high GSH result and the well over the 4 or 4.5 range, which would indicate very, very low thyroid function, or it can be many other results that they just seem to skip over. Doctors don't tend to see or interpret the results as a whole, and instead just looking at an individual result compared to the reference range. So they're not looking at I'm sure we'll probably talk about iron studies later, but they don't look at the iron studies results as a whole, and you need to interpret them properly. Also, occasionally, just due to issues with equipment in the testing lab, there may be one result that is just way out of line for where it perhaps should be, and where other tests are certainly not indicating that. So errors occur with equipment or with the handling or whatever of some of the results. So that's often not looked at. And I think it's important to not just take an individual result on its own, but actually look at confirmations and looking for the confirmations of the abnormal results in other tests to confirm, because it's not always clear. An individual may not actually be, for a couple of reasons. So there's a few issues with pathology there. Sure, there's some more. I can't think of any at the moment.
That's all right. Okay, so what are some of your interpretations of the pathology results, and how come? And what's different about them to, for example, what the mainstream medical industry will be reading them as?
Yeah, the key one really is the nutrient deficiencies that I'm specifically looking for. Doctors not trained in nutrition, they don't understand. I think what the red blood cell result that I mentioned earlier may actually mean. They don't understand that the red blood cells need zinc, they need protein, they need iron, vitamin B12 and folate, for example. So, and obviously kidney function and bone marrow function, and even then it's dependent on thyroid function too, which controls the metabolic rate of the whole body. So the body works as a whole, not just in isolation. So you can't just take an individual result and compare whatever the result may be to that reference range. You do have to look at a broader picture of all of it to interpret. So I do utilise that, but I'm also looking for organ dysfunction in the results as well. So nutrient deficiencies and or excesses, but also organ dysfunction, but based on the optimal ranges and not the reference range. And looking for confirmations and interpreting the results as a whole, not just a line by line individual result. And it's a really much better way to go about interpreting the results for someone.
Okay, can you give us a couple of examples of these common nutritional deficiencies that you see missed by the mainstream medical industry that you're constantly finding there's a problem with in your patients?
Yeah, I think the big ones would be certainly around the red blood cell count, but also the white blood cells, and to make the white blood cells, I already mentioned the red blood cells. The white blood cells are very different. They're very similar in terms of the nutrients they need. Again, protein, zinc, vitamin B12 and folate. They just don't necessarily need the iron that the red blood cells do. So if someone is lacking in B vitamins or zinc, which is extremely common, it's going to affect one or the other, or possibly both, the production of red blood cells and white blood cells. So that's going to, potentially contribute to fatigue, low energy, but also poor immune system function, with the white blood cells not being able to perform their normal duties in protecting you from various pathogens, viruses, colds, flu, and dare I say it, COVID going around. So they just don't. Doctors don't learn nutrition, and certainly not enough nutrition to know that these particular nutrients are needed to make red blood cells or white blood cells, or for the thyroid to function, for example. You need all of those nutrients plus more. Selenium, iodine, vitamin D, all needed for thyroid function as well. So if you're looking at interpreting the thyroid function, obviously you can get an idea a little bit from some of the thyroid markers, but to get a better idea, you really need to, certainly in what we do, look at those individual nutrient tests as well. So I try and get zinc for every client as well, because I find it's actually the biggest deficiency, or the most common deficiency in most people, and they just don't know about it. The iron studies test that are getting as many of the iron-related markers that can interpret B12 and folate. I highly recommend that practitioners get as well, because they are greatly affected by so many factors, not just dietary, but stress and digestive system function and even thyroid function as well. So zinc, B12 and folate, iron, and probably vitamin D are some of the biggest deficiencies that we typically see. So I'd rather get to finding out what these particular nutrient levels are in most people, or where they're indicated to be tested for, and see if these are actually contributing to their issues. And in most people, they usually are. And they don't know about it. It's rare for a GP to, certainly on the first test that they might do for someone, to get the iron studies, or even certainly the basic or full thyroid panel, for example. They don't look at TSH, which isn't really ideal, and very, very rare for them to look at folate or B12, and certainly not zinc. So I think they're missing out on a lot of the causes to people's health issues, and that's not what they look for. But it can be quite simple to really find those deficiencies by including those tests in some of the standard tests that you recommend for your patients.
I agree. Can we come a little bit back to the thyroid? Because I feel like that's a big one that does get skipped over a little bit. And I think the reference range for TSH when I was a naturopathic student was the upper limit was 2.5, and now it's 4.6 or something like that. So it, like you said, they're taking blood from sick cohort of people, and this is what's bumping the ranges so wide. And as you're saying, you're not looking at the reference range, you're looking at what you think a healthy range should be. So can we chat a little bit about some of your thyroid ranges and what's necessary to test for thyroid?
Sure. I think just to give a little bit more background about the thyroid test, so TSH, which is the thyroid stimulating hormone test, is actually a pituitary hormone. It's not a thyroid hormone. As the name suggests, it's produced in the pituitary to stimulate the thyroid into producing its hormones T4, which is the inactive form, which then gets converted to T3, the active form. So typically doctors will only initially test for TSH, which is an indirect marker of thyroid function, and the reference range typically is, say, 0.04 to 4 or thereabouts, which basically covers everybody with a normal thyroid, a high-functioning thyroid, and a low-functioning thyroid, all in one reference range. It's probably the worst reference range out of any test marker. It's just utterly ridiculous, and why doctors don't, often find anything, because it's just too low on one end, which is, showing or missing all the people with high-functioning thyroid, or the range is too high, which is, indicating so many people with a low-functioning thyroid. So my typical recommended optimal range for the TSH is about 0.7 and 0.8 to 1.5.
Okay.
Many other practitioners use 2.0 for the upper limit of TSH, but I still see in people with the 1.5 to 2 range, TSH result, they're still having a lot of issues to do with, they're really still indicating a lot of low-functioning thyroid, so weight gain, low energy, poor memory, cognition, thinking, headaches, and fatigue and things like that. So I do know some practitioners that use similar ranges, but the ranges I use are based on studies that are done in healthy populations, from training courses and things that I've done as well. So if people want to use 2.0 as an upper limit for TSH, then that's great. But just be consistent about that. But also perhaps keep in mind that even that 1.5 to 2 range, people can still have some of the minor symptoms of low functioning thyroid. So ideally, we as natural therapy practitioners should be looking a little bit wider than just the TSH result, but looking at really at the very least the basic thyroid profile of TSH, T4 and T3. If you can get those, you will get a better idea of how the thyroid is actually functioning, because we're actually looking at the T4 and the T3, which are the thyroid produced hormones, although T3 can get converted in other tissues and around the body as well. The liver, as well as the thyroid, and other tissues as well can convert. If we're looking at a completely detailed and holistic investigation of thyroid, now ideally we probably want to look at the reverse T3 hormone as well, and the thyroid antibodies. It's not often a surprise, perhaps, when we get someone's full thyroid panel, and yes, it is a little bit more expensive, but the amount of data and detail you can get from that is really helpful, and we can often find a lot of undiagnosed issues when we're looking at the full thyroid panel as opposed to just the TSH that the GP might order. So we're looking at the inactive T4, we're looking at the active T3, and both of those provide a negative feedback loop back into the pituitary. So the pituitary is actually acting on the levels of T3 and T4 in the blood, and if T4 or T3 are low, then the pituitary will produce more TSH to stimulate the thyroid. So, come on, mate, get a move on, make some more. But the thyroid can only do what it can from the nutrients that are available in the body or from the diet, or from a dozen other factors that can affect the thyroid function. So the thyroid can only make T4 if there's sufficient iron, several B vitamins, zinc, iodine, vitamin D, and others, if they're available. So if there's deficiencies in any of those, then the thyroid function is going to suffer. There's a huge number of factors and nutrients needed for the thyroid and many other factors that inhibit thyroid function. And we can determine that to a degree by looking at the reverse T3 hormone, which, if there's sufficient resources to convert the inactive T4 to the active T3, then that's great, but often there isn't. And if not, then T3 doesn't become T3, it becomes reverse T3, which won't have an active and metabolic function on the cells. So the conversion from T4 to T3, and we can easily see whether that's working even without the reverse T3 test. Even then, that's ideal. So just divide the T4 by T3 to get a ratio, and if the ratio, the result is optimal, then it's suggesting that conversion process is okay. But obviously, the reverse T3 hormone is a better and more accurate marker of that. So, and T4 to T3 is dependent on zinc, selenium, and vitamin D, for example. So we need to make sure that those levels are actually okay. Otherwise, the client will have a high reverse T3 result, which actually inhibits or blocks the thyroid receptors on cells and actually slows down the metabolism and ends up causing more problems. Thyroid antibodies can be very useful if there's any suspected autoimmune activity against the thyroid, which comes up a lot more often than people think. Certainly a lot more often than GPs think. So someone can still have thyroid antibodies, so basically an autoimmune attack against the thyroid, even though the TSH and even the T3 and T4 are actually okay or even optimal. So you've still got to find the causes of any thyroid dysfunction, and that's a huge part of what I do. Is a little bit different to many other practitioners, but my aim really is to find all of the root causes of someone's health conditions, and then to put a plan in place to actually treat those root causes. I'm not just treating the symptoms, which is the typical medical approach, but actually getting to the root causes, which are really about the nutrient deficiencies, how well the digestive system is working to digest one's meals and turn and release those nutrients, and how well those organs are working, but also what external factors typically are affecting those organ functions, and to fix those. So I'm not just using the nutritionals or herbals to reduce the symptoms, but actually get people to fix their problems and actually get them fixed, or their health issues resolved. So it's a very different approach as well.
Okay, well, you partially answered the question I was thinking of in relation to thyroid and in terms of the antibodies. What kind of range are you looking for? Because your range is very tight for thyroid, actually, in comparison to what we see on a blood test with the reference ranges. What point are you actually looking for potential further testing on antibodies with the thyroid with the TSH levels? Because if you've got a TSH in that range, like you're saying, there's no way the doctors are going to go and request the antibodies. Is that something that there's other things that are involved, and then you're going, okay, we need to do some further investigation?
Yeah, you're right. The GPs will only typically start with TSH, and they won't look at getting T3, T4 or thyroids unless the TSH result is way out of the reference range. I think the integrative doctors are better, that they will investigate things a little bit deeper and can often find or look for or test the antibodies much earlier than the GP or even the endocrinologist might. If the client has any other autoimmune condition or any symptoms of any autoimmune condition, then I will usually recommend getting the thyroid antibodies tested, because what often happens is when someone gets or has one autoimmune condition, they will get 2 and then 3 and then more. It's because the same factors, whether it's nutrient deficiencies or other organ or tissue dysfunctions, actually create that autoimmune action, and it can start against one tissue or one organ in the body, but then it can progress to another and another. And I've seen several clients with at least 3 autoimmune conditions, but it all started from the same causes. So the good thing is you can find those causes, treat those deficiencies, improve those or reduce those factors and improve those organ functions, and then you're fixing 3 autoimmune conditions instead of just one.
Because it is something I see, you see a TSH that's in the range, but for some reason they've had their thyroid antibodies done and they're not in the range. So that is a common thing I have seen. It's not super common, but you do see it, right, where the TSH is in the reference range, but they've got antibodies presenting.
Right. Yeah, and luckily at that stage, though, it's the autoimmune action against the thyroid, which hasn't got severe enough to actually affect the thyroid function. So it's if you find that's really good, because that you're really finding it very, very early, before it becomes a major problem, and that can make it a little bit easier for you, but also the patient to get over. So, and that's really the benefit of getting that complete thyroid panel with the antibodies and hopefully T3 and T4 at least as well. So you are really finding what is going on with the thyroid, and not just indirectly through the TSH result, which is just the pituitary hormone.
Do you use any other outside home tests, like for example basal body temperature, to check for the thyroid to coincide what you might be looking at on a pathology result?
I have done in the past, and I don't do it all the time, but where I suspect perhaps that may be going on, and if I think the client is a little unsure, or they're a little bit wary, or I have done that in the past. But when it comes to obviously we're trying to find the causes of their problems sooner rather than later, and if I think it's just it's going to take longer to find a result if you try and do it that way. Sometimes, and it's important to be a little bit flexible, I guess, in your practice, that some clients just can't afford to do the testing. Sometimes they can't afford to see the GP. Sometimes the GP just won't do the test because they don't think it's justified. So you've got to be a little bit more flexible around that, and you can work with the clients. So in cases like that, yes, you can use the body temperature, providing it's a good quality thermometer and not the $2 ones from Woolies. Under the tongue ones, so they're not very accurate. And you can test yourself 10 times in a minute, and they'll all be different. It's not ideal, but if you have a good quality one for sure, you can use that and log it over a period of time, or at least a few days to check and see where the one's temperature is, and then you could potentially treat based on that. But obviously, in an ideal world where the client can actually afford to get some pathology testing done, you're going to find the answer more quickly than trying to do it that way.
Okay, can we chat a little bit about iron? Because this is a really big one, I think. Most people are aware to check the iron if they're feeling a little bit tired. But there are so many factors involved with iron and hemoglobin. Can we maybe dive into iron studies a little bit?
Sure. Yeah, it's one of the most troubling tests and combinations of tests around. Really, there's so many possibilities around it, but it is a fascinating one. It's a really good one to learn a lot more about.
So where should we start?
Right. Okay. Look, the iron test is it can vary a little bit from lab to lab in terms of what markers they're actually looking at. But typically, the iron test is called the iron studies test, and you'll typically get approximately 4 different markers. Number 1, you'll get the actual iron or the serum iron result. You'll get the transferrin saturation, which is basically a percentage of the iron saturation, and ferritin. You'll either get one of transferrin or TIBC, which is another iron-related marker. So you usually get one or the other of those. Just depends on the lab and what they use. Just very, very briefly, the actual iron, the serum iron result, which often the doctors will just get in isolation, which sometimes they can do rather than the whole iron studies test, is not a good marker of your iron status at all. It really is just looking at the amount of serum iron in your blood, resulting from your last meal before the test. So you could have decent sized steak the night before the test, and of course your iron level may look quite good, if not potentially even excessive if you had a large amount of iron. Or if you had a vegan meal the night before the test, your iron level will look terrible. It'll look like you're deficient, but you may or may not be. And that's the important part of interpreting the pathology, is not just to take an individual result on its own, but actually look for confirmations in other tests, or other test results. So that's why the iron level, the serum iron, is just basically looking at your iron intake. Some of the other markers, like the TIBC, transferrin, and the transferrin saturation, are more looking at how well you've actually consumed iron, how well your stomach has been able to digest your iron and release the iron, and then how well your body's been able to absorb that iron and build it back up into these particular proteins. So transferrin is a protein, ferritin is a protein, hemoglobin is a protein that's related to iron levels as well, but it's actually not in the iron study test. So just on that note, interpreting iron, you do need more than just the iron studies test. It is useful to have a look at the whole big picture of what's actually happening in the body. So I would typically look at the full blood count or the full blood exam test as well, which is going to give you ideas of hemoglobin, which how well, again, the body's been able to utilise that iron and turn it into hemoglobin in the red blood cells. Now, your red blood cell count and quality in terms of their volume or their size, whether they're microcytic or small red blood cells, or the large immature macrocytic blood cells, or if they're okay, because that's going to give you another indication of potential iron deficiency symptoms there as well. And even thyroid function, again, is important, because the low functioning thyroid will result in low digestion of foods, low absorption of iron, low metabolism of iron into some of these other proteins. So it's a much bigger picture. But we can just, for instance, just look at the actual iron studies test. So iron, as I mentioned, is really just about your intake. TIBC is a measure of all the proteins in the blood that are available to transport iron, including transferrin, but not ferritin. So interpret the iron, we need to know how much of the binding proteins are present in the blood, and that's what the TIBC is actually representing. How the amount of iron that can be transported in the blood. Transferrin is a protein. It is related to iron levels, but don't forget it is also a protein, and it is relevant to the amount of protein in the diet, but also can be affected by some of those same things we mentioned earlier: thyroid, stomach function, even zinc levels as well. Transferrin is a transporting protein, as the name sort of suggests. The trans being transport, and ferrin relating to iron, so it's a transport protein. And the transferrin saturation is a calculation that's dependent on the iron result and the transferrin result, and it actually gives an idea of how well the iron levels are actually in the blood and being transported. So low transferrin saturation is indicating an iron deficiency, or a high amount can be other types of anemia, or iron overload, or iron poisoning even, or too high levels of iron supplementation. So it just depends on the range there. Ferritin is slightly different. Ferritin is your storage protein of iron. So again, it is a protein, so it is dependent on your iron intake, protein digestion in the stomach, and protein absorption and metabolism as well. So it is dependent on zinc in many ways there too. So someone can have quite a good iron intake, good levels of transferrin saturation, but the ferritin can be still very low, and that can be dependent on some of those other factors that I mentioned. Stomach acid, low zinc, low protein. But there's also so while ferritin itself is the best marker of your iron levels, because it's your iron stores, it can actually give you a false positive or a false result. If you the client is having a lot of inflammation in the body, or if they've got some sort of an infection, and this is how our bodies are extremely clever. When we're exposed to pathogens, whether it's a bacterial or viral infection, our bodies will actually make more ferritin to bind to iron and prevent the pathogens from actually being able to utilise that iron they need to replicate and obviously spread around the body. So it's a natural defence mechanism against infections when our body's making more ferritin. But again, it can only do that if there's sufficient protein or zinc or other factors involved. So someone may have quite a good ferritin result, but it may actually be a false good result if they've got a lot of inflammation. Again, why we need to look at the inflammation markers also in relation to the iron studies. So you should look at CRP, which is your acute inflammation marker, your ESR, which is your chronic inflammation marker, and maybe even homocysteine as a systemic inflammation marker as well. And perhaps even vitamin D, which is as an anti-inflammatory hormone. So when vitamin D is low, inflammation can rise as well. So ferritin is a really good marker to look for, but you've got to be aware of a lot of the other factors that are involved in ferritin. It can also be extremely high, and that may just be from again very high inflammation, or it can be from other issues in the body, higher absorption conditions of iron, and so we were talking about hemochromatosis, for example. So, and whether someone may be just a carrier, so they'll have often have a mild elevated ferritin result, or sometimes it can be in the thousands. They'll have a very, very high ferritin result, which the full-blown hemochromatosis there. So I like the pathology because there's a lot of what ifs, there's a lot of factors involved, there's a lot of confirmations, and looking at other things. It's certainly not as easy as it perhaps looks on first glance, and certainly not as easy as perhaps the doctors make it out to be, just comparing your ferritin result to the reference range. You've really got to look at it, all of the results as a whole, and interpret the pathology that way.
Okay, cool. Thanks for covering all that. Now, I just wanted to ask, so you mentioned about elevated ferritin, so thanks for covering that, because I know infection, hemochromatosis are some of the big factors with ferritin, which is really important to understand. Can we maybe touch on a little bit about zinc and copper in the blood? Because I know, as you mentioned, serum iron being kind of involvement of the last meal. What are your interpretations with zinc and copper?
Yeah, some of my favourite tests to have a look at there. I particularly like zinc. I do actually recommend every client to get their zinc levels tested, because when it is the most common deficiency, the most unknown deficiency, but it can cause so many other symptoms or health issues, because it is used at many hundreds of enzyme reactions, metabolic processes, and a lot more in the body. So it can have a significant impact. So the zinc and copper minerals, they don't like each other very much, put it that way. They're antagonistic, and when one is too high, the other one's usually too low. And that's because they compete for the same transporters or cellular transporters. So we usually find through diet and other factors that we're more exposed to copper than we are of zinc. One of the big reasons why is that our houses have copper piping, which brings in the water into the house, but also goes through the hot water system, which is all lined with copper piping as well. It's a great conductor of heat and electricity, for that matter too. So we do get a reasonable amount of copper exposure through our water piping coming into our houses. But also, a lot of our common foods are reasonably high in copper. But there's not a lot of foods in some people's diets that actually are high in zinc. So there's more of a push for vegetarian and vegan diets, for example, at the moment, and they're typically very low. Vegan diets are extremely low in zinc. There's not a lot of plant-based foods that contain zinc, with the exception of perhaps nuts and seeds. But even then, with people who are more now omnivorous and getting a lot of animal-based foods which are high in zinc, when you're stressed, again, your body's not, particularly your stomach, isn't going to function as well to digest and release the zinc from that, so you can still get a lot of deficiencies there. It is very important to have a look at the serum zinc level. Copper is very important as well, but I think probably you should be more selective perhaps on when to order the copper result if you do suspect it. Some of the main issues that I see the need for checking for copper as well as zinc would be mental health. mental health symptoms, so anxiety, depression, and even some more severe or chronic mental health symptoms or conditions like chiral disorder, bipolar and schizophrenia, for example. What can happen is, not always, but usually in those conditions, someone will have very high copper levels, very low zinc, and that can contribute to the issues with regard to mental health, a lot of mental health symptoms, because zinc is needed a lot to make the hormones, or the neurotransmitters and the hormones for good mental health, but also good metabolic health all over as well. So if zinc, for example, is low, but also the copper high, you can get a lot of those mental health symptoms. So if you suspect that, or if you see that in your patients, perhaps have a look at the copper level as well. I wouldn't necessarily recommend getting the copper test for too many other symptoms or conditions. I think in an ideal world, if we were able to get all of these tests done, we would get a really good picture of what's going on with someone. But the tests, do cost money to get, and not everybody's got a lot of money to spend on getting a whole bunch of tests done privately. So
that's a good segue to the last question I wanted to ask you. What are some of the key tests that you think that someone should be requesting? If obviously signs and symptoms are going to, lead you to testing other things, but if someone's just listening to this podcast, they want to go and get a general bloods test done, what are some of the main things you want to start with testing?
I've got about half a dozen tests that I recommend should be done as standard. Some of those we've mentioned already. So, and bear in mind that some of the different labs and in different states have different names for these tests, but I'll name the most common names, but also what's actually in them. So the full blood count, or also known as the full blood exam, basically is looking at the quantity and quality of the red blood cells, but also the white blood cells as well, and with some little individual breakdowns of the red blood cells and white blood cells and different markers, and also platelets. So there's about a dozen different test markers in that one, so it does cover a lot of things there. Iron studies that we mentioned, the thyroid panel, and at the very least, try and get TSH plus T3 and T4 as the basic thyroid panel, but if you can get the extensive one with the antibodies and reverse T3 as well, you will get a much better picture and much better idea of what's going on there. So those three. Another one that's called, by some labs, the electrolytes and liver function test, sometimes just called serum biochemistry, sometimes just called biochemistry. It's a really detailed test, this one, in about 20 different markers. So it covers 4 or 5 electrolytes, from sodium, potassium, bicarbonate, etc. Also covers kidney function, so it'll have some of the metabolic waste products of urea, creatinine, uric acid, and the kidney filtration rate. So it's a good one for checking on kidney function. It also has liver function, so there's at least 5 different liver markers in there, different liver enzymes that can be indicating liver damage or poor functionality of the liver. And also that particular test has some protein markers in there as well, so it'll have albumin, total protein, and globulins, so your immune system protein. We'll also have your blood glucose and your cholesterol, typically cholesterol, your total cholesterol level, and your triglycerides, and perhaps a couple of other markers in there as well. So it covers a lot. It's a pretty cheap test on its own, but it has a lot of information you can get from it, especially if you get some of the other tests that confirm things as well. Zinc, as I mentioned, highly recommend for everyone, and I think vitamin D is really important for a lot of people as well. A lot of people think they're getting enough time outside in the sun and getting some sun in their skin, and which is how we make vitamin D. But there's a lot of other factors involved in vitamin D production which can affect the natural vitamin D levels. So some people think they're getting a lot of sunshine, but actually can be very low in vitamin D. So they're really just the basic 6 or so tests that I highly recommend as a basis to get. But then any other tests that may be indicated from symptoms or signs that you think you want to investigate further. So in practice, I get a lot of questions about from clients saying, "Oh, should I go and get some more current blood tests before I come and see you?" And I actually say no. I say, "Look, just bring me the results that you may already have, if you had some recently or even a couple of months ago or earlier. Bring those ones or send those results to me. I'll analyse them, and in the initial consultation I'll ask a lot of questions about their signs and symptoms and in detail and trying to get to the root causes. We'll analyse their pathology results and based on their previous results, and if I feel that it's been a while since they've had tests, I'd recommend repeating them, or if they're more current, I will still use the results and perhaps recommend some additional tests to get. It just depends on their symptoms or some of their other pathology results. It's a good practice, I think, at least once a year, even if you're healthy, to get some blood tests done and get them analysed properly. And sadly, that's not through the doctor. More and more nutritionists, naturopaths, and even herbalists are learning more about pathology and interpreting them in a better way, and actually finding issues perhaps well before they become a major problem when your result goes way outside the reference range. So at least once a year, have a checkup. Try and get those tests, whether you go through your doctor, whether you go through your natural therapist, or whether you get the test done privately. You can do that. But it is most important to get those results analysed properly and holistically, and not just through the GP. So that's a service that I can offer in analysing those results, using my software and generating a report which can explain what's going on and why, and perhaps what other tests may need to be done, and certainly what nutrients you may need to have a look at. With regard to practitioners, I have been running regular training on interpreting pathology results in this holistic naturopathic nutritional way, and each month I have a training event on where you can learn more about pathology results. So it's a 3.5-hour training webinar, plus the training notes, plus some other resources as well. And it is very cheap. You can learn to basically do what I do, but also even better to use the software tool that I have developed is available, that then you can use them to provide pathology analysis services for your clients as well. So that is available. The details are available on my website, which is just rosswalter.com.au/pathology if you want to find it a little bit easier. But it is a fascinating area to learn more about. As a practitioner, I highly recommend more practitioners learn more. But as a client, if you get some bloods done through your GP, but you're not happy with the GP's interpretation that everything's okay, when obviously you weren't when you went there, do see your practitioner, or find a practitioner that can analyse the results in a better way and actually find what's going on with you before it becomes a much bigger problem later. I hope that helps.
Yeah, that's great. Thank you so much, Ross. So I'll make sure I link your website and some of the seminars and events that you hold for our prackies. And if any patients want to reach out to you, they can find you there. But I just want to say thanks for sharing this